Let's start. As you know, these are tea times with me. You get to ask questions about all kinds of disorders and diseases of chronic nature, especially whether it's molds or mycotoxins, whether it's neurological and neurodegenerative disorders, whether it's breast implants, whether it's children with learning disabilities, autism, etc., or it's heavy metals or Lyme, etc. So this is just a disclaimer. I'm not trying to tell you what to do. These are some of the positions I hold. I can tell you that I'm also a member of the Royal Society of Medicine, and I'm also the author of over 100 studies and published studies in medical journals and chapters in medical textbooks. I'm a speaker internationally at medical conferences. So here we go. I always bring up something I haven't discussed before. So here's a complex, this is a very important statement because complex syndromes, chronic pain, fatigue, cognitive impairment, etc., all linked to autoimmune dysautonomia. This has been repeatedly noticed in the history of medicine that several diseases, which initially, at first, they're considered each being separate, but with time appear to be the same disease. And that is so important and is so prevalent in patients affected by indoor molds and the mycotoxins they produce. These are toxic molds. In the same study, a group of complex disorders, including chronic fatigue syndrome, POTS, CSRPS, complex regional pain syndrome, silicone implant incompatibility syndrome, etc., all stem from the same issue. So what is the best test to use? It's MyMycoLab's 14 different mycotoxins, both IgG to see if it's a toxic reaction and IgG to see if it's a mast cell activation currently in the body, not a urine test, which measures what has left the body. And what do they say in the medical literature and medical publications? This is from October, a year and a half ago. The test method used by mycotoxin in human serum comes with significant accuracy, precision, and specificity. So don't use the urine test. It's not a validated test, okay? Here's what you can read on this secret. It's not a validated test. These are also nonsense tests. Don't waste your money. They have nothing in medical science to do with the issues of molds, mycotoxins, and other chronic diseases. So this is the MMP9, the HLA-DR, the genetic test, etc. These are all these are myth tests. And here's a study. This slide is thanks to Dr. Ariv Ajdani, who presented it at A4M in December, 6 months ago. Several popular organic acid tests, the OAT tests, claim to detect imbalances in gut bacteria and fungi, but those markers on these tests do not measure what they claim to say. And here's the study that you can go to and read. So it's not just an opinion, it's proven. And look for body burden of chemicals, not chemicals coming out of my urine, not what has left the body. Measure what is in the body, like mycotoxin antibodies, not mycotoxin in urine. And here's a very common mistake I see all the time. Healthcare practitioners pick up a piece of paper and say, oh, this says it's positive for this and this and this. I'm going to treat you for this. They don't really know the medical evidence on these diseases such as Bartonella, Babesia, and Lyme, go to MyMycoLab's YouTube channel and watch the webinars I've given on these diseases. And at the bottom of every slide is what study it was from. So it's not opinion, it's not anecdotes that are all over the internet. These are actual studies that look at these things and tell you what is the real science and medicine behind it. So let's go back up here. Okay, so binders, that's another big myth. So this is the study, the only study in the Medical Library of Medicine under the National Institutes of Health. Okay, these include kaolinite, clays, activated charcoal, zeolite, bentonite, etc. They're only effective for one mycotoxin, aflatoxin, which is not found. Okay, it's not in indoor air. They're ineffective. They don't help with all the other mycotoxins, all the other 14. And on top of that, they bind vital vitamins as well as macro and micro elements such as zinc, magnesium, and other very essential elements. I always recommend Itraconazole, but now Itraconazole is being used in cancer. On the left side, these two photographs, upper and lower on the left side, show this huge cancer growing on the forehead of this poor man. After 59 days of Itraconazole, look what it's done. It's just obvious. So we know that Itraconazole was developed in 1980. It's been in use for decades with an established safety record. Here's a more recent study. Itraconazole is proved to be a valuable addition to the antifungal drugs currently available for treatment. It's been well tolerated with doses up to 400 milligrams a day, being generally free of serious side effects. Don't read what's on the internet. Read medical studies that show you the medical and scientific evidence, not what some guy or woman is saying on the internet. And please, folks, be aware of this slide. Fluconazole only treats single cell molds, okay? Those are all the yeasts that are used for making bread, for making alcoholic beverages, and so on and so forth. Okay? So please, folks, use Itraconazole, which gets rid of both the single cell, which are the yeasts, and the multiple cell, which are Aspergillus, Stachybotrys, Penicillium, etc. What about binders? They're all over the internet. Oh, I want to put you on a binder. Well, here's the medical evidence. Okay, you've seen this, we've talked about it. What about taking supplements? I have emails, 5 to 10 emails every day, 7 days a week, 365 days a year. I've been on binders for 2 years, 3 years, 4 years, etc. And supplements, 20, 30, 40 supplements. Well, they did a study on 60 of the common dietary supplements. 11% have what it says on the label. 40% don't have what is on the label. That's why I recommend very specific supplements from very specific laboratories. Not get on the internet and go to Amazon or wherever and buy whatever you think is there or whatever they're handing you at an increased price at your local, whoever it is. In treatment, this is essential. The first and the foremost part of treatment, the first rule of toxicology, get the patient away from the toxin or the toxin away from the patient. Second, You build back the immune system while giving an antifungal. That's the Itraconazole and the 6 to 8 supplements. That is all that is needed. 6 to 8, folks, not 20 or 30 or 40 or 50. Here's another thing. I did the ERMI test. Look at the date at the bottom right-hand corner, August 22nd, 2013, 11 years ago. The public may be making indoor mold cleanup decisions based on EPA tool developed only for research application. It's not a valid, good test. Forget the ERMI. I want to tell you about this patient, couple of patients here. I agree with you on every level. They should, who is they? These healthcare practitioners who claim they know about mold, and they took some course online. They didn't really study it. They just took something, paid a few bucks, and now they're mold experts. They should focus on getting it recognized and covered by insurance instead of simply lining their pockets while people that can't afford their pricey visits, testing, and supplements. It's sad. Yes, it is. Here's two more I'm going to share with you. I must say that your treatment program was working just like you stated in your videos and technical papers. These are not technical papers. These are actually published studies in medical journals. On the 4th month, during the paradigm to the letter, I was feeling 85% better at that point. The fatigue attacks had disappeared. The brain fog and mild cognitive impairment was much less. And I even had to reduce my thyroid medications, etc. Now, here's another family that wrote this to me. My family and I had moved into an old house and didn't realize it was riddled with mold. We became very sick with all the symptoms of mold illness. I quickly realized the local doctors that I sought help from were not able to help. I found Shoemaker online and started following his protocol with one of his certified by what body of medicine? No, by some guy. Some things help. And finally, finding a clean house to live has been very beneficial. But after almost 3 years, we're not well. We have 4 young kids, and this sickness has been debilitating. Well, folks, it takes 6 months, not 3 years, to get well from this. Okay. And then lastly, I think that is important to recognize that if you want the published studies, I'll be happy to send them to you. Here's 2 studies: mold, mycotoxins, the brain, the gut, and misconceptions, that I wrote with Dr. Weinstock, who's in St. Louis, Missouri, and is from Washington University School of Medicine there. Lyme disease and mycotoxicosis, how to differentiate between the two. So, folks, these are 2 important studies. Now, let me add answer some of your questions. ALS, let's talk about Lou Gehrig's disease, which is amyotrophic lateral sclerosis. Okay, it's a fatal disease. Studies have shown now that 5 to 10% of Lou Gehrig's disease is genetic. The other 90% is caused by mycotoxins. Therefore, it's a reversible issue. I also want to clarify, I told you it takes 6 months to get well from this. At the end of 6 months, you have to repeat the test again. Make sure there's no remnants. Don't just say, I'm well, okay, bye-bye. No, you've got to repeat this mycotoxin blood test. And here's another one. This person is so afraid of antifungals and side effects. Would you give us some more information? And I just did. I did not start the treatment because of that. If you think that any natural supplement, like I just showed you, that 40% don't contain anything that they say is going to help you, why do you think patients come to me after they've tried everything? They've tried oregano oil and these Peau d'Arco and all. They've tried all that and they're still sick. But people read these opinions on the internet, not the studies that I showed you, but opinions, and say, oh, your teeth are going to fall out, your hair is going to fall out, your brain is going to fry, and all kinds of things about mycotoxins, about using itraconazole. It's all false. It's false. Okay, it's also important to continue the treatment until the serum mycotoxin antibody test levels are normal, instead of when it just showed I'm better. They've got to come back to normal. These are toxins. They're bad players. They hijack cars. They've got guns and knives. They hang around and sell drugs at street corners. They do all kinds of mean, nasty things. Do not trust that, and trust what is in your body. You need to know what is going on inside your body. Alpha lipoic acid and neuroprotect. Folks, if there were studies saying these work, I would tell you. There's no such studies that say they do anything for toxic molds or their mycotoxins. Okay. Here, let me tell you also about treatment. The first 8 to 10 weeks, you don't feel anything on treatment. Nothing changes. Why? Because you're so far in the red, in the negative, I should say, not the red, but in the negative. Okay. And then after 8 to 10 weeks, people start little by little noticing positive changes, positive changes, positive changes. That's when it happens. Here's a patient. 3 months into the paradigm, was doing better than 15 minutes, was an old mold environment. Don't go back. I told you, these people are bad people. With what? Symptoms back, fatigue, POTS, depression. Did I undo all my progress? I don't know. I would have to know a lot more about you. The doctor wants to start amphotericin B nasal spray. My diet needs improvement. Yes, you've got to be on the right nutritional diet. You can't have any sugars. You can't have any gluten. Okay, and you've got to eat healthy as much as possible, eating foods that your great-grandparents and grandparents and on back to Adam and Eve ate, which is organic. Could you please explain mycoplasma pneumonia due to tick bite? Thank you. That is an internet myth. There's no medical or scientific evidence of that. That is another one of these internet websites from so-called experts. 5 months of itraconazole and full protocol, all of a sudden the palms of my head and soles of my feet feel as though I put them in hot coals. Should I stop treatment? No. It means that somehow, somewhere, you are re-exposed. A large majority of cancers have been linked to mycotoxins in the library of medicine. That is absolutely correct. In a study of 17,400 cancer patients, 35 different kinds of cancers, I should say, sorry. So 17,400 cancer patients, 35 different cancers, all of them had toxic mold. All right. What are your thoughts on generic Sporanox, which is itraconazole, versus brand label? And is there is this the preferred treatment for aspergillus? That's the correct spelling. Being high on your test. Yes. Well, all generic medications, drugs, etc., are made, all generics are made in India or China. And sometimes they may not be as pure as we'd like them to be, although they're less expensive. Name brand Sporanox is as pure as you can get it. However, about 10% of my patients say, you know, I started this Itraconazole and then I didn't feel good, like my stomach was upset, et cetera, et cetera. I switch them to Sporanox and they're fine. So that's what I can tell you about that. So I tested positive for mycotoxins 2 years ago. I was just diagnosed with PPPD, and vestibular migraines this month. Are these disorders related to mycotoxins? Yes, they are. If so, if the mycotoxins are treated with Itraconazole, will this go away? Yes. So let me explain it to you. There was a study published 20 years ago on how toxic molds and mycotoxins cause acoustic neuromas and what is the treatment, Itraconazole Sporanox. So that is a study that's 20 years old. So that's been known in medicine 20 years. It's in a medical journal. I'm currently out of mold. Unfortunately, my doctors are not familiar with mycotoxins. Well, you have here my email address. You can get help. I can either send you someone in your area who knows about this, or if not, someone who does telehealth. What is my opinion about using Itraconazole with alprazolam? Patients on alprazolam, patient with alprazolam over 15 years. My God, do you know what is the half-life of alprazolam? It is very long. So what does that mean? It means that any person who takes alprazolam, it's 11 to 12 hours half-life. So let me explain that. If you took 2 milligrams this morning, tomorrow you have half as much. You have 1 milligram. But if tomorrow morning you take another 2 milligrams, now there's 3 milligrams in your body. Then the day after, there's 1.5. You take 2 more. Now there's 4.5. Do you understand what that means? You've got to slowly decrease that. It's kind of like being on a addictive drug. Okay. What brand of vitamin C? Having a hard time finding good brands of phosphatidylserine to get 500 milligrams. Yes, because the place to go to for plain vitamin C and phosphatidylserine 500 milligrams is a lab known as Clare Labs with a K, Klare. Okay, that's what I take. This is what my family takes. This is what I recommend to my patients. Please speak about ochratoxin. In one of your handouts, you mentioned it's not reliable on urine tests. Why is that? Urine test for someone came back with sky-high ochratoxin. Also, why no citrulline? Same patient, multiple miscarriages over 3 years. So I don't know if you saw the beginning where I said, don't measure what has left the body like you did in urine testing. That's left the body, but get it what is in the body, which is much more essential. Second of all, it's not a validated test. Third of all, in studies, you cannot excrete ochratoxin. Fourth, if you look at the top left-hand corner of that report, it says metabolite. You're not measuring the actual mycotoxin, you're measuring the metabolite, okay? What that means is if you had today at lunch asparagus, your urine is going to smell of asparagus because that's the metabolite. That's what you're measuring. Wrong test. My family lived in Missouri. Us and our 5 children are suffering from old illness. Can I get help from your website, or do I have to have someone locally? You do not. Here's my email address. Just write to me and I'll help you. Which mycotoxin antibody is the best? Well, let me take you back. If you got on here a little late, and I'll show it to you. This one, MyMycoLab test. It's the most precise and accurate test for mycotoxins. And that's not the lab that says it. This published study, and you have this at the bottom, that is the reference to that study published in October, about a year and a year, 4 months, 8 months ago. The ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. MyMycoLab serum to antibody test. You can order it yourself. This is true. Get on that website that is in the chat there. And then when you get the test results, you get a free consultation with me. What about the paradigm that research lags 20 years behind in clinical guidelines? You're reading Dr. Google. You're not reading medical science. That's another one of these Dr. Google opinions. It is not based on medical and scientific evidence. What happens to the brain? The first place toxic molds and their mycotoxins attack is the brain. So will your pituitary get better? Absolutely. And that's very common, the ADH issue. Very common. And once you're treated, it goes away. What are your thoughts on using Biosid and liposomal for treatment for mycotoxins? It's bunk. Any thoughts on the use of methylene blue? It only treats single cell molds, which are yeasts. Yeasts are used to make alcohol beverages, alcoholic beverages, and bread. So no, I don't recommend it. Do you recommend the GAP diet? I do not. Do binders have any benefits for heavy metals or other toxins? They do not. There's no medical or scientific evidence that they do anything. If you take glutathione, okay, so if you have gliotoxin antibodies in your blood inside your body, and you take glutathione, it'll increase the levels of gliotoxin. It'll make it more toxic. Now, if you want to use sauna, that's helpful. If it's infrared sauna, and you use infrared sauna and you start low and go slow, are binders helpful? I just here, read this on binders. Okay. I gave it to you. Perhaps you didn't see it. There, binders are, last sentence, binders are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements. Please watch the program from the beginning. Are we stuck on the for more info page? Sounds like he's moved on. Okay. Thoughts on low-dose naltrexone for pain management during treatment? Why would supplementation with vitamin D make me feel worse? Because you have the wrong type of vitamin D. Get it from Claire Labs, vitamin D3, 5,000 international units, 1 daily. Because of the migraines, I stopped the Itraconazole in May. I took it for 4.5 months. I would like to start again. You need to start it with Sporanox, not Itraconazole. And yes, you need to start over. Can you post all the links for the studies? Well, these studies are just two. I've published over 100. Are you going to read 100 studies in medical science? I can send you these or some others, but don't rely on Dr. Google and the internet. Okay. Watch the YouTube videos that are on MyMycoLab's YouTube channel. I discuss everything. Lyme, breast implant, you name it. It's all in there. Do EMF sensitivities improve with proctical? No, they do not. You have to treat the cause, not just use something. Where are you going to get this? Is this a proven laboratory? Remember, I showed you that 40%. Is NAC okay? No. NAC promotes glutathione. You can't do anything if you've got gliotoxin. Don't use NAC and don't use glutathione. I don't recommend any herbs which are so popular, especially among the naturopath crowd. They don't work. I am serious and not sure what to think. If I'm detoxing and not taking binders, won't risk be a big hoax. 1% of the more than 17,000 patients I've treated get herpes, and it lasts a week. I tell them to don't stop anything and keep on going. Can Itraconazole in a generic form, have you known it to cause chest pain? No. Itraconazole is $2,000 per month. It depends on you. For example, Blue Cross Blue Shield has 32 different plans just in the state of Texas. I can't keep track of every state, etc. So I would recommend getting it from a Canadian pharmacy. So during Itraconazole, I've never heard of, in 35 years, 17,000 patients, I've never had anyone complain of cold sores and low sex drive. Switch to Sporanox. Is Itraconazole not as good as Sporanox? Correct, in some patients. Do I give the test? Do I give the test myself to my children? Yes. You can do it by yourself. How do I know that you'll be sent information? Plus, you get a free consultation with me to go over your test results. You order the test, it's sent to you, you can do the blood draw from a mobile lab and send it back. And then they send you the test results. I have to have meds compounded due to allergies for the fillers. Yes, that's very common. So, unfortunately, are you saying the generic is not as effective? No, I'm saying some people don't react well to generic because who knows, it's made in China or India, who knows what they put in it. Claire Labs doesn't have a website? Yes, it does. Claire Labs, just as you spelled it. Okay. I have orange level of zearalenone and vomitoxin. Is that why my estrogen and progesterone are very low? Yes. Zearalenone is highly estrogenic mycotoxin. It causes all kinds of problems with this. Not only estrogen and progesterone, but in men, testosterone. It lowers testosterone to almost nothing. Any other questions, folks? By the way, we are taping this and it'll be available. What if Itraconazole isn't strong enough? What about amphotericin B? Amphotericin B is only used for intranasal purposes if your sinuses are affected. It's a very weak antifungal. Do you recommend also being treated for migraine with a preventive medication while taking Itraconazole? Well, it depends on every case. In general, in my patients, those migraines go away once they're on Sporanox. I was exposed to molds in 2019, 2020. Most of my symptoms have gone away, except my hair loss and thinning of hair. I have massive hair loss while living here, but moving out, still thinking, will I ever recover? Do the test and then see, and then talk to me on you get it for free. You get to talk to me for nothing. I thought with treatment, the mold toxins are removed from cell membranes, and would the membranes heal and sensitivity improve to food and chemicals? Yes. Where would Fusarium be in my house that would explain? I'm sorry, but I've never been to your house. I've never looked through all the air conditioning ducts in your house or at your basement or attic or et cetera. It could be in many different kinds of places. Can you list all the websites where you can purchase each supplement you recommend? Yes, get them from Claire Labs. If ERMI is unreliable, how do you recommend testing a house? I know how to test human beings. In MyMycoLab's YouTube website, I did 2 webinars with a gentleman called Brantley May, who's an inspector. Go and watch those. What kind of insurance pays for the antifungals? Would a Christian shared type insurance help? I have no idea. Do you know how many? I mean, this test is available in all countries on the planet. I don't know what other countries do or what each state does or which insurance plan does which. So those are things you have to find out on your own. If you suspect mycotoxins but have not been tested, would you still start a patient on Sporanox proactively? No, I don't treat something I think of. I have to have medical and scientific evidence. I have to see, does this patient really do it, have it or not? Not, are you going to take insulin thinking maybe I have high blood sugar? Or are you going to do a test for blood sugar? If supplementing with the ALS patient who has difficulty swallowing, are there tips about how to administer supplements? For example, can we dissolve phosphatidylserine and thin broth or soup? Absolutely. And ALA our lipoic acid is the same. There's no medical evidence for those two. It's very specific for ALS. And I've treated many, many patients with ALS, including one very good close friend who got back in the saddle and doing well. If you ask me about insurance, because you need to ask people who know about insurance, not a doctor. Okay. What are the supplements to take along with the Sporanox? I would recommend that you go to MyMycoLab's YouTube channel and watch the webinars on treatment. Is organic dairy okay? I don't know what is your particular situation. Can you list all of the websites where you purchase each supplement? I just told you, Claire Labs. Can mycotoxin cause SIBO? Yes, and there's some very compelling evidence that shows you. This is an actual photograph of a young woman with SIBO. She took it herself, front of a mirror, sideways, so you can see her belly, which looks like she's 6 or 7 months pregnant. And 3 months later, it's flat. Watch my webinars on MyMycoLab's YouTube channel. Okay. If you visually see it, do a tape and swab test. If not, get an air sample test plate. I personally used immunolytics. I don't know about immunolytics. Again, I recommend you go to MyMycoLab's website and watch the 2 webinars I did with Brantley May, who's an expert in this, and gives you the pros and the cons of each testing. Well, what draw lab will do the mycotoxin blood draw? Will LabCorp or Quest? No. LabCorp and Quest are general labs. They do cholesterol, they do pregnancy tests, urine tests, etc. They're not a high complexity test like MyMycoLab. You can go to any lab test now, or you can have a mobile testing person come by and draw your blood. When you search Clear Labs, it takes you to many sites, not Clear Labs directly. You need to look at the website for Clear Labs. Yes, there's other websites further up on the internet, but go to the Clear Labs website, not the other one. Here is the website. Thank you for providing that. Do the supplements need to be taken with the antifungals? Or can we take only, no, it's a whole treatment plan. Again, go to my the many webinars I've given, it's all there. It's Clear Labs website, ussfihealth.com, yes. Here is your SIBO. Thank you, Dr. Rogers. Here's the before and after of SIBO. Any other questions? Nitric oxide, so good. Why is nitric oxide so good for mycotoxins? It is not for specifically mycotoxins. It increases the blood flow to the brain, bringing more nutrients, more medication to the brain, because this is where toxic molds and mycotoxins first attack. If ranges of mold are medium in the lab report, we don't do molds, we do mycotoxins. How long would it take? It's 6 months. And let me ask you something. Let's change the name, okay? To, instead of mycotoxins, let's change it to mercury. How much mercury is it okay to have? None. So you don't want any. You have to have treatment. I'd like to see a PM after Itraconazole pick. I'm not sure what that means. Can you buy all recommended supplements from Clear at the website? Listen, again, go to MyMycoLab's YouTube, watch those webinars. Why don't more medical doctors know about mycotoxins, how to treat them? Finding a competent doctor in Connecticut has been difficult, very difficult. Now, I'll tell you why. It's because of all these crazy, unproven tests that are all over the internet, and doctors don't like that. They don't like these mark-ons, which doesn't exist in medicine. They don't like all these other tests and all these weird treatments that are out there, like binders. They like to see real medicine that really helps people. Mycotoxins affect all hormones. I've done several webinars on just how mycotoxins affect hormones, and aldosterone is a hormone. Having trouble finding a home rental I'm able to tolerate before treating. Any tips? Move to dry area. This basically, that's not a real medical question. I don't know how to answer that. Now, the probiotic is the best probiotic to use is Mega Spore Biotic. Yes, this is true. Thank you, Dr. Rogers. More and more doctors know about mold, toxicity, and mycotoxin antibodies because Dr. Campbell is educating us and educating patients also. Then what are mark-ons? I tested positive. It's a sham test. There's not one medical study in the 120 million in the National Library of Medicine that talks about anything in mark-ons. It's a myth. It's a sham test. Whether you test positive or negative, forget it. It's like a male testing positive for pregnancy. It's not a real diagnosis. It's just from the Shoemaker and Neil Nathan crowd. It's not a real disease. It's a myth. Any more questions, folks? What to do if you can't afford testing and doctors, and those are insurance questions. I'm sorry, but I'm a medical doctor. I don't deal with insurance. I don't know what to say about it. I'm not an insurance expert. I'm a medical expert. Okay. Well, thank you, folks. I think we've covered a lot of things. Again, if you want more information, go to MyMycoLab's website. Here, let me give it to you here. Hey, go to this website and look it up. Or you can go to my website, www.andrewcampbellmd.com, and you can see all the 68 webinars I've given. So how long is too long to be in on Itraconazole? It's different for every patient. You can't say one shoe doesn't fit everybody, but in general, 6 months is what it takes. All righty, folks. Thank you so much for coming. There'll be another one soon, and you'll get information on it. Thank you so much, Dr. Rogers, for your help.